So today, part 2, we're talking about how your veterinarian or how we are going to diagnose that your pet needs TPLO surgery. The first thing we do is during the exam, we watch your pet walk around. So we have a look at their gait and how they're moving. Then I'm going to closely examine them, feeling the muscle mass, the size of the muscle, and I'm going to have a good close feel of the knee. There are 2 specific movements that I'm going to put the knee through that check on the stability of the cruciate ligament. So the first of these is called cranial draw. And what I do here is I artificially put pressure on the tibia and I see if the knee is stable. When there's an intact cruciate ligament, then I can't move the 2 bones apart from each other. But when the cruciate ligament is ruptured, I'll be able to feel cranial draw. The next test I'm going to do is something called tibial thrust, and this mimics the dog putting weight onto that leg. And when I check for tibial thrust, I can feel if there's some give each time your pet's putting weight on its leg. X-rays are then a really important tool for us diagnosing cruciate ligament because some dogs will have a partially ruptured cruciate ligament, and so that will feel stable when I examine it. But when we take X-rays, I'll be able to see a lot of puffiness in the joint or the start of osteoarthritis. In humans, they often use an MRI scan to determine if this is what's gone wrong in a person's knee. In dogs, we don't tend to from purely economical reasons. So an MRI scan of a dog's knee is very, very expensive. We can normally make the diagnosis without that. There's also the option of arthroscopy, but again, this is quite limited and very expensive and needs to be done as a separate procedure to the repair, which is why the X-ray works so well as how we diagnose it. Part 3, coming up next, is going to be talking about what if it isn't a cruciate ligament rupture.